Heart block is a condition that affects the heart's electrical system, the network of signals, responsible for keeping the heart beating in a steady, coordinated rhythm. Unlike many heart conditions that announce themselves with obvious warning signs, heart block can develop quietly. In its early stages, it may cause little to no discomfort, allowing it to go unnoticed for months or even years. These silent symptoms make heart block particularly dangerous, as the condition can progress before a diagnosis is made. To understand heart block, it helps to know how the heart normally works. Each heartbeat begins with an electrical signal generated in the sinoatrial SA node, often called the heart's natural pacemaker. This signal travels through the atria, causing them to contract, then passes through the atrioventricular AV node before moving into the ventricles. Heart block occurs when these electrical signals are delayed or completely blocked as they travel from the atria to the ventricles. Depending on the severity of the blockage, heart block is classified into first-degree, second-degree, or third-degree complete heart block. In first-degree heart block, the electrical signal moves more slowly than normal through the AV node, but it still reaches the ventricles. Because the signal is not fully blocked, many people experience no noticeable symptoms at all. This form is often discovered accidentally during a routine electrocardiogram, ECG. Despite the lack of obvious symptoms, subtle signs may exist, such as mild fatigue or a feeling that physical activity requires more effort than it used to. These symptoms are easily dismissed as stress, aging, or lack of fitness. Second-degree heart block is more complex and can be divided into two types. In one type, the electrical signal gradually slows until a beat is skipped. In the other, some signals are blocked without warning. People with second-degree heart block may still appear outwardly healthy, but silent symptoms can begin to surface. Occasional dizziness, brief moments of confusion, or unexplained weakness may occur. These episodes are often short-lived, leading individuals to ignore them or attribute them to dehydration, low blood sugar, or exhaustion. The most serious form, third-degree or complete heart block, occurs when no electrical signals pass from the atria to the ventricles. The ventricles then rely on a much slower backup rhythm. While this condition can cause dramatic symptoms such as fainting or chest pain, it may also present silently at first. Some individuals adapt temporarily to the slower heart rate, experiencing only subtle warning signs like persistent tiredness, reduced concentration, or shortness of breath during mild activity. Because these symptoms develop gradually, they may not immediately raise alarm. One of the most common silent symptoms of heart block is chronic fatigue. When the heart beats too slowly or irregularly, it cannot pump enough oxygen-rich blood to meet the body's needs. The brain and muscles are especially sensitive to reduced blood flow. As a result, a person may feel constantly tired, even after adequate rest. This fatigue is often mistaken for work stress, poor sleep, or emotional strain, delaying medical evaluation. Another overlooked sign is lightheadedness or near fainting. In heart block, brief pauses in the heart's rhythm can reduce blood flow to the brain. These episodes may last only seconds, causing a fleeting sense of imbalance or dimmed vision. Because the feeling passes quickly, many people do not seek medical advice, unaware that these moments could be early indicators of a serious conduction problem. Exercise intolerance is also a subtle but important clue. Individuals may notice that activities they once performed easily, such as climbing stairs or walking briskly, now leave them unusually breathless or weak. This happens because the heart cannot increase its rate effectively in response to physical demand. Over time, people may unconsciously limit their activity to avoid discomfort, masking the underlying issue. Heart block can also affect mental clarity. Reduced and inconsistent blood flow to the brain may cause difficulty concentrating, memory lapses, or a general sense of mental fog. These changes are often attributed to aging or anxiety, especially in older adults, but they can be linked directly to an undiagnosed heart rhythm disorder. The danger of silent symptoms lies in their ability to blend into everyday life. Risk factors such as aging, heart disease, high blood pressure, diabetes, infections affecting the heart, and certain medications can increase the likelihood of developing heart block. Because symptoms may be mild or absent, regular medical checkups play a critical role in early detection. A simple ECG can often reveal conduction abnormalities before serious complications occur. In conclusion, heart block is a condition that can quietly undermine heart function without dramatic warning signs. Fatigue, dizziness, exercise intolerance, And subtle cognitive changes may seem harmless but can signal an underlying electrical problem in the heart. Recognizing these silent symptoms and taking them seriously can lead to timely diagnosis and treatment, potentially preventing life-threatening outcomes and preserving long-term heart health.